We believe that while we have made significant progress over the last 20 years from a therapeutics point of view, and by over the last 20 years I mean specifically targeted drugs against MS, we still think there's room for improvement. And we think that room for improvement lies in several places. One is to help physicians and patients optimize their choice of therapy. Two is in the area of repair. So even if one controls inflammatory activity in the brain, patients still have sustained some damage to their brains, even at the time of diagnosis, and they may have relapses later. And we are interested and actually have a number of programs in development to try and help repair the brain, and we're presenting data on our anti-LINGO monoclonal antibody at this meeting, and are very intrigued by the data, which shows that we may actually facilitate remyelination and thus recovery from an acute inflammatory event. So I think the challenge with any chronic disease is one that somebody needs to worry about it. Ideally, we don't want them to worry about it. In fact, one of the things we want to do is make treatment convenient. We want to reduce the burden of the treatment. Again, a reason why Tecfidera is so valuable, I believe, to patients and becoming the standard of care. But more importantly, it is challenging because one has to be aware that, as you say, with relapses, in between relapses, if a patient is well and doesn't have residual impairments or disability, it may be easy to forget about the disease. But many patients, even patients early in the disease, actually do have impairment and are aware of their disease every day. I think also you make the point that there's an increasing awareness of what MS is. I think it's one of the things that's driving diagnoses. In the past, patients weren't necessarily seeking therapy or being diagnosed aggressively because they had no therapies. But now, with the panoply of therapies that are available, patients are pursuing diagnosis, and the physicians and neurologists are very keen to make the diagnosis because they know there's something they can do.